I think if everybody's here, we're ready to get started. Can you hear me okay? Great, thank you, everybody. We didn't invite gobs of people today because there's a pandemic. And so we thank the press for coming to help us cover this. And thank you. I'm Sheila Smith. I'm co-chair, along with Amy Bedini, of the Family Council of Nathaniel Witherall. Witherall is a 202-bed nursing home here in Greenwich. Today marks the one-year anniversary of the lockdown and lockout on long-term care facilities, not just here in Greenwich and Connecticut, but across the country. 1 year, we call it a banniversary, because all visitors, including family members, have been banned from visiting their loved ones in long-term care facilities. 1 year of isolation and starvation from contact. And now it's time to have a conversation about ending this. Today's rally is the kickoff event for a series of rallies in Connecticut. This is part of a multi-state campaign to draw attention to the banniversary and the treatment of residents in long-term facilities who've done nothing wrong to be separated from their families, nothing. So this is part of a multi-state campaign from here in Greenwich. It moves upstate. There are other rallies nationwide, and we have some very specific ideas which you're going to hear today about how to end this lockdown and lockout now. We're thrilled to have the Greenwich First Selectman, Fred Camillo, here. We also have, making comments, we have Liz Sternono from the Connecticut chapter of Connecticut Caregivers for Compassion. We have our state ombudsman, it's actually an ombudswoman, Mairead Painter, came down from Hartford today and has been working on these efforts tirelessly for the last year. And then to conclude the remarks, we have Jenny Larkin, who is host of this event, and she has a very poignant family story to share with you. On a personal note, I'd just like to say that I implore healthcare workers, not only in my community, in long-term care facilities, but healthcare workers across the state and the country in nursing homes. Now that we have a vaccine, please get vaccinated. There are many healthcare workers who are refusing the vaccine, and this just prolongs the isolation and contact starvation and the lockdown in these homes. COVID does not discriminate by race or ethnicity. We have a vaccine now. Let's all join together to kick COVID out of our community. And now, please join me in welcoming our First Selectman, Fred Camillo.
Thank you, Sheila, and thank you, Jenny, for hosting this. Good morning, everybody. I think one thing we could all agree on is something as bad and horrible as the virus is the actual isolation. We all know people that have passed on, who have died alone, which should never ever happen. And I think we all can agree that we always want to be careful. Right? We didn't want people going in there in and out, getting our most vulnerable sick and infected. But as Sheila said, now there's a vaccine and there's hope now. And last year, many of you came to me. We had a chat about visitation, and I was happy that our facility here in Greenwich did amend their policies. And I know there's still some concerns about the visitation, and we're going to work on that and hopefully make sure that people can meet in private. But certainly, you always want to be safe rather than sorry. So we totally understand that. We're supportive of that. But as Sheila said, encourage people to get vaccinated. This has gone on long enough, and we don't want to see anybody else pass alone, not being surrounded by their loved ones. It's bad enough passing, but to do it alone is something horrible. And every one of us here believes we all deserve better than that. So again, thank you so much for bringing this to the forefront. I'm hopeful things are getting better, and certainly policies can be adjusted, and they will. So better days are ahead. So again, thank you for doing this, and God bless.
My name is Liz Stern. My mother died in a nursing home in Connecticut on November 3rd. My mother died in a nursing home on November 3rd. Her name was Annette Caprio Onofrio. I'm her oldest daughter, and her husband still lives. He's 95 years old in Mystic, Connecticut. I'm not here to talk about my mother's story. Thousands of stories have been told in Connecticut. Tens of thousands of stories have been told across the country. Connecticut is one of 16 states who are doing just as we are. New Jersey started a few days ago. Florida started a few days ago. But today is the official start to say enough. Before I speak any further, I think it's important to talk about where we are today. This movement in Connecticut was driven by a group called Connecticut Caregivers for Compromise, because isolation kills too. There are 50 chapters. There is a chapter in every state. It was started by Mary Daniels in Florida in June. More locally, I want to thank the people of Greenwich, especially Sheila, because if it wasn't for Sheila, we'd be here standing in front of our signs quietly holding a vigil. So thank you very much, Sheila Smith. I can do a lot of things. I like to read, I like to learn, but I don't know how to do this. So I am eternally grateful to Sheila for saying, you need people to listen, you need people to get there. So it's because of Sheila and Jenny offering this site. We know that we have to be safe, but safety needs to be redefined. And that's why we're here. We want to be safe, as staff has tried to be safe. And as I speak about staff, I think it's important, it's immensely important to talk about the staff who have stepped up to the plate to take care of our loved ones when we were shuttered out. So many of us were what we now call essential caregivers. We never gave ourselves a name. We were there by our loved one's side every single day. We ate with our loved ones, and we made their new home as home-like as it possibly could be. Nobody has a nursing home or a long-term care facility in their downsizing plans, in their retirement plan. Certainly my mother did not. She lived in a beautiful 4-bedroom colonial till the day of her stroke. And then her home became a nursing home. And it was a process to make that her home. But we did. We were out on the streets of Mystic, going to the bakery, sitting by the riverside. She had a home until March 10th. So we thank the staff that have done the best that they could, but no nurse can replace a daughter. No nurse can replace a spouse. No nurse can replace a brother or sister who sat by your side. We've written thousands of letters. We've given scores of interviews. We've talked to the media. We've worked with our ombudsman, and still that does not seem to be enough. There has been guidance. There has been improved guidance. We all heard about September 17th. Some of us celebrated. Mairead Painter gave us the guidance the day before it went public. We were ecstatic until we weren't. So we need more than guidance. And when CMS does come out with their guidance, and we all know they will, we need to have discriminating eyes. We need not to take words for face value. We need to not any longer hear the word should or may or shall. We need to have those words replaced with the words will and must. And then we need facilities to listen, and we need our regulators to regulate. This is not on my notes today. This is what I have been living for a year. This is what the long-term care ombudsman program in Connecticut has helped us to understand. And for that, we are eternally grateful. I think Mairead may touch on this, but just in case you don't, Mairead, the Nursing Home Reform Act of 1987 included a Bill of Rights. These Bill of Rights are law, a law that has protected those who live in long-term nursing home facilities or long-term care facilities for well over 30 years. We're here to ask, what happened to those rights that are guaranteed by federal nursing home law? It's quite a document, and I invite all of you to look at it. But I'll highlight for you, and I quote, that the nursing guaranteed by federal law, what happened to the right to a dignified existence, the right to self-determination, the right to be fully informed, the right to raise grievances until there is immunity, until there is a state of emergency? What happened to the right of access to individuals, services, community members, and activities inside and outside of the facility? And I'll end with this. What happened to the right of access to visitors of one's choosing at any time? There is no person here who wants our loved ones to be safe. There is not one person here who does not understand safety. There is not one person here who would not have undergone all of the precautions that every staff member did in Connecticut. We're here to ask all who have stood outside of closed windows of their loved ones this past year to hold on to the energy that has been stirred and to continue to stay involved and informed. Ask the hard questions and keep asking them until there is nothing less than a full restoration of human rights, civil rights, and residents' rights. A state of emergency is never an excuse to abandon rights. Well before March of 2020, I had the good fortune to work with the long-term care ombudsman program in Connecticut. Lindsay Jessup was the first person who I worked closely with, and she helped me to navigate to start a family council in Mystic, Connecticut. After that, Tricia Calderon helped me, and she passed the baton to Dan Beam. Without Dan Beam, I would not be here today. I was being worn down, and I knew when I was at my very bottom, I needed support. And I called Dan and I said, Dan, I cannot have another care plan meeting. I cannot have another phone call unless you're by my side. And from that moment on, in the summer, Dan was on every phone call with me. He championed my mother's rights. He stood by my side. For that, I'm eternally grateful. Today, it's my honor to introduce the person to whom we owe a debt of gratitude. Without this person, many in Connecticut would be working alone, scrambling in solitude to address the ills of isolation and more. In June, Mairead Painter's Facebook Live provided a meeting place to ask hard questions, a place to be listened to, a place to learn, a place to cry out, be angry, and most importantly, a place to connect. If not for Mairead and the arena that she continues to provide, I would not be in front of you today. Please help me in welcoming Mairead Painter.
Thank you very much, Liz. That was a beautiful welcome, and I so appreciate it. Before I start, I want to thank all of... You can't hear me. Okay. Is that better?
Wait, try to raise the microphone a little bit. Yeah.
Okay. How's that? All right. Well, thank you, Liz. Before I begin, I want to thank all of the individuals, the family members, the residents who have joined every week together and supporting each other through the Facebook Live and have become a resource for themselves and supporting each other. It is so important. And for my team members, a few that are here with me today, I couldn't do this without the just incredible work that they do on a daily basis and the support from Commissioner Porter, our commissioner. As you've heard, I'm Mairead Painter. I am the state long-term care ombudsman here in Connecticut. Long-term care ombudsmen both here in Connecticut and across the country work to protect the rights of residents. We protect their right to autonomy, choice, and most of all, appropriate care. For decades, we've been working to move away from a model that was just a medical model to a model of person-centered care. This is for all of our long-term care communities. We moved in this direction because it was identified that residents required a holistic approach in order to have the best quality life. We learned that this meant giving the same attention to their social and emotional needs that we gave to their medical care. Since the beginning of the pandemic, long-term care settings have been at the crosshair of this national tragedy. Millions of residents have been at greater risk of severe symptom and even death. On March 13th, it'll have been a year since the doors of nursing homes across the country were closed due to guidance at a federal level. This guidance came out of CMS. It required that all residents remain within their communities and at almost all times within their rooms. It meant that family members, friends, individuals that normally provided daily support to residents were no longer able to access the homes. What does this mean for residents? Well, we know that there's caregivers. Our nursing home staff have been going in on a regular basis and providing care to residents in the most challenging of times throughout this pandemic and doing everything that they can. We have had a staffing crisis here in Connecticut for years. This has just been further impacted by the pandemic. We know that staff want to be there for residents, but they're trying to provide for all residents. And some residents have unique needs. These unique needs and gaps were often filled by family members and friends that came in to otherwise support individual care needs. That no longer happened during the pandemic. Those individuals often had to wait or not get the normal level of care that they had become accustomed to. Who's at fault? We often want to find someone at fault. The challenge here is it's really the fault of the pandemic. We know that the guidance that came out on September 17th from CMS did expand visitation and compassionate care visits. Compassionate care visits were originally just for end-of-life situations. However, now that guidance has expanded them to meet individualized need. The challenge that we have is the interpretation of that guidance and our ability to message what those needs are, to be clear about residents' ability to identify their needs, and to be represented by loved ones and family members that know the residents best. They need to be a part of the care team that is helping to understand what those needs are and support residents through this very challenging period of time. We have had immense support from our elected officials. We had the governor call for an independent report, which was the Mathematica report, and then we had the Nursing Home Assisted Living Oversight Work Group, horrible name, NALOG. But from that work group, we have produced recommendations that will have meaningful impact in the lives of our long-term care residents. I think it's important for everyone to remember we've all gone back to some sort of sense of normalcy in our greater communities. However, our long-term care residents have not. They remain impacted on a daily basis by the pandemic. If there are any positive cases in their nursing home, visitation inside, traditional visitation, is stopped. That's a 14-day period, and then if there's active testing, it is stopped, or if the community rate of COVID-19 is above 10%. That's where everyone in the public can do their part to make sure that our numbers don't go that high ever again. That directly impacts residents' access to inside visits. But they always have the right to a compassionate care visit, and that's what we're really asking for today, to honor the essential support that family and friends provide in a way that matches the criteria of the compassionate care visits and allow people to have the highest quality of care. We have had good support from our state leaders. However, they are bound by the guidance that comes out of our federal government. So really, this is a plea to our federal government, to CMS, to honor the fact that residents have accepted the vaccine. The majority of the residents in our nursing homes have been vaccinated at this point. We know that there were staff that were concerned about the vaccine. Again, they've been through a lot of trauma this year. We're asking them to please become vaccinated so that we can start to get back to a place of normalcy and to have the federal government honor that. But even prior to that point, to have every resident's individualized needs assessed through their person-centered care plan, and for it to be identified if they need a compassionate care visit and who they feel can best meet that need. I want to thank everyone for being here today and for the ongoing support that you've all given to the residents of our long-term care communities here in Connecticut. So thank you very much. I want to introduce Jenny Larkin. Thank you.
Hi, thank you so much for coming out today to my home. I'm going to tell the story of my mom's personal story of the last year. And I did write it down because I wanted to make sure I didn't go all over the place. And it's about 5 minutes, so hopefully you can stick around. My mom, Nola Modine Larkin, was healthy, beautiful, and happy the last time we saw her at the Nathaniel Witherell, her home, 1 year ago today. She was loved and cherished by her large family of 4 children, 17 grandchildren, and 23 great-grandchildren, as many moms are. And she was my best friend. A bright, funny, computer-literate senior, Mom lived independently with me for 12 years before a stroke disabled her right arm and leg. After rehab at Nathaniel Witherell, she chose to stay there because she really felt it would be better for everyone. Another stroke took away her speech later that year, but her career as a Broadway actress enabled her to communicate and entertain with facial expressions and body movements. She participated in many recreational activities, and she was blessed to have staff and caregivers who genuinely loved her and cared for her. Then she met the love of her life, George. The next 4 years were so happy, she shined. People would say to me, "You could be sisters." Okay. And I was okay with being compared to my beautiful mother.
Then came the COVID-19 lockdown and drastic measures to save lives from this deadly new virus. No more visits. So I relied on the information from social workers and other staff because that mom was not able to communicate by phone. The only way she could communicate was visually, so phone calls were not an option. I knew how well she'd been cared for and had faith that everything was being done to keep her safe from COVID. I joined the family council and created a fundraiser to buy staff lunches when the cafe shut down and gathered donations for masks and PPE when it was in short supply. God bless the frontline workers. We're all in this together. We scheduled 40-minute Zoom calls so all of my family could join and say hi and see her. The technology was challenging at times, but it seemed hard for her to hear and see us sometimes from the iPad in her room, but it was better than nothing. Then, in July, I saw her roommate's obituary in the newspaper, and I noticed that she had died a full month before. I remember a Zoom call where my mom was trying to tell us something about her roommate. And this was when I first realized that I had no idea what my mom was going through inside. And I started asking questions about her emotional well-being to the staff. I asked, why didn't you tell me that my mom's roommate had COVID and died? Sorry, privacy. How is George? Why didn't you tell me, Mom? How is George? Has she been able to see him? Even in the hallway? Sorry, privacy laws. I learned and followed the rules established by local health professionals and the Connecticut Department of Health, and continued meeting twice a month with the Family Council to advocate for my mom's resident rights. It seemed that no matter what we suggested, it was a violation of some kind of health rule, policy, or procedure. Then I had my mom's quarterly care meeting where I found out that she had lost 25 pounds. I wasn't quite yet alarmed, okay, because she had gained a lot of weight during her years there. And I knew that weight loss would eventually allow me to have compassionate care visits if I asked for them. But I still wasn't clear what those were. Outdoor visits were a blessing. And I was thrilled to see my mom in person, first from my car in the parking lot and then in the Rose Garden, where I visited with my daughter and my granddaughter, who had just been born in May. Each time a COVID case was brought into the home by the staff, however, family visits were suspended. Even when in-persons were available, they filled up so quickly on the first-come, first-served digital calendar. Sometimes it was 3 weeks between visits. Growing more concerned about her mental health, I asked if I could hire her current staff caregiver to come in and spend extra hours with her, but learned that the nursing director had just ended that policy in August due to insurance concerns. I could hire a stranger, but I don't think that's what my mom needed. With the colder, I bought her new clothes because she'd lost so much weight, and I thought it would pick up her spirits. With the colder weather, visits moved into the outdoor pods with masks and stricter rules due to the confined space. Only 2 visitors, so no more Samantha and baby Aria. And I went and visited her alone. When I visited the pod, her family Zoom meeting was canceled. It was either one or the other, but not both. So my brother and sisters in California, Utah, and Georgia could not see Mom that week. I tried to use FaceTime and Zoom to include them when I visited in person, but there's no Wi-Fi or cell service in the pods. I recorded the visits to share with them, and we noticed that she was starting to have really bad days. I noticed that her glasses were missing, and she lost a tooth. At Mom's last care meeting, I learned that the antidepressants she'd been given weren't working, and they asked if we should raise her dose. But I read that antidepressants are for clinical depression, not for seniors suffering from failure to thrive due to loneliness and isolation. I insisted that she was unhappy due to the isolation and from not being able to see her family and George. Her caregiver even said that she was becoming frustrated and uncooperative. But I was told it's not isolation, just a natural part of aging. I was so fortunate to visit her in person for her birthday, December 10th, and she actually seemed okay. Finally, in January, I was offered to move Mom to the second floor where she would see her beloved George on a regular basis. I was elated. 2021 was going to be the best year ever. I received photos of Nola and George's reunion on the second floor, and I broke down crying because I was so relieved. Even if I wasn't able to be with her, she would now be happy with George. But that didn't last for long, because soon after the reunion, I received a call from her new social worker saying we may have to move Nola back to the first floor. It seems that seeing George, but not being able to be with him as they were before, not being able to touch him or take off her mask, made her more uncooperative and upset. At least my mom had received both doses of the vaccine and wasn't going to die of COVID. I just had to hold out a little while longer and things would be back to normal in a few months. And then I heard her caregiver from the first floor was retiring on February 1st, and I knew that moving her to the first floor was not going to be an option. So I met with her nutritionist, and I thought, I'll order her Cracker Jacks and dark chocolate covered nuts because I know she really likes those. Maybe she'll eat those. And of course, I had to have them shipped from Amazon because I was not allowed to deliver any food in person or it would be thrown away. My last in-person visit with my mom was Thursday, February 4th, and she looked horrible. She wasn't able to sit up, and her lower eyelids were sagging and red. She seemed to pass out and then come to, and then she violently motioned towards the door. Out! Out! I asked if she wanted me to get her out of here, and she nodded and went, yes. Then I freaked out. My mom looked like she was dying, and I was so upset. I stepped out of the pod, and I was hysterical, and I asked the wheelchair transporter, I said, help me. And she looked at me like I was a crazy person, and I saw somebody else transporting someone back to the facility, and I was like, I need help. And she looked at me strangely, and I was like, never mind. And I ran back in, and I said to my mom, Mom, I'm going to do everything in my power to get you out of here, get you the help, or get some visits. And I said, I'm going to work all weekend and I'll get back to you on Monday. I'll do this on Monday. You just have to make it through the weekend. But Monday, she died. Thank you.
I'd like to thank you, Jenny, not only for hosting this today, but sharing that very poignant personal story. Sadly, that's not the only story, but it is the only one that we'll be sharing with you today. We need to let family back in. Thank you all very much for coming. Thank you.